There you
Hi, everyone.
go. Right. Are you ready?
Yes, I'm ready.
Yeah. Okay. I'm going to press start. Do you want to chat as we're going in, or do you want me to just go straight in with
Yeah, let's chat
welcome?
because I don't have a lot of content.
Right. I'm going to start now. So you've had a good day at work?
It's been a really good day at work because I only worked half a day.
Oh, did you?
I know, it was wonderful. This never happens to me. But I just had patients from 2 o'clock, so 2 till 6, pure
Oh,
day of restorative. Was doing just quadrant dentistry, 3 patients. It was amazing.
that's nice.
Oh, it was lovely. But what's really sad is my amazing trainee nurse who I've trained from scratch. She was a restaurant manager, came to me, trained her from scratch. She qualified and now she's leaving us. And it was her last day today.
Oh no, where's she going?
She's found a booper practice that are offering her what do you want to call it? Healthcare, insurance.
Right, okay, yeah, so that's
And
better.
for her, mature newly qualified nurses, so she's 37. She's gonna say the same age as me, but I'm 39. Um,
I'm not telling you how old I am.
um, but for these sort of things mean a lot. Having
Mm,
health insurance means a lot to people, and I can so see why she would want to move when we
yeah.
couldn't offer it because we're a small independent practice. There's just not something we could do. But how about you? How was your day?
Yeah, good, thank you. Good. I think everybody's wondering why we're chatting and telling us that we're live when we but yes, we're just waiting for everybody to log in, and then we will get started. So yeah, I had a nice day. Um there was a couple of perio, like juicy perios, so that was good. You always enjoy juicy perio, on a Thursday. So yeah.
We had a patient a bit like that. I'm going to send you the pictures actually because it was
Oh,
an
okay.
implant patient where you'll be like, what
Oh,
on earth is
yeah,
this?
yeah.
But I had a patient like that on Tuesday, and my nurse was squealing with delight. So
It's great
funny.
when you get a nurse like that who's really
To it.
they've invested. That's what we want, invested.
She was great, but I was a bit like, tone it down a little bit. The poor patient.
Yeah.
Patient's got a sweat bead.
Oh gosh. Okay, shall we get started? Yeah. So welcome everybody. Welcome to the Ikigai webinar series. I hope you've all had a good day. As you can hear, Kat and I have definitely had a good day. So I'll just start with a little bit of housekeeping. The webinar is recorded. It will be uploaded in probably about 7 to 10 days onto the My NSK website. So do be patient while we get that sorted out. In terms of CPD, you will probably receive an email Monday or Tuesday next week from NSK. If you fill in the feedback, and you will get your certificate sent to you. So just remember, it will be beginning of next week before you receive anything. There is also a discount code for this evening, which I will put into the chat box whilst Kat's speaking. And Kat said that she's quite happy to take questions in the chat if it's a sort of a quick, easy, short one. If it's a little bit more involved, then maybe pop it in the Q&A and I will pose it to Kat at the end of the webinar. So without further ado, I will pass over to Kat. She knows a little bit about ultrasonic tips, so she's going to impart her knowledge on us all.
Thank you so much, Catherine. Okay. Good night. Good evening, everybody. Good evening. I will just say, if the chat might be disabled. I think sometimes when we start the webinars, it might be disabled. So it might be worth us just double checking that. But
I'll
if
have a
you can't
look.
get anything into the chat, just stick it in the Q&A, and I will find it. I'll find your questions. It's not a problem. So evening, everyone. I'm Cat Edney, and you have heard that I was working clinically today and having a lot of fun with my patients this week, and I hope you all have too. We're talking today about ultrasonic tips and why you choose the ultrasonic tips you choose. I'm going to speak about my favorite tips and the indications, the times when I choose them as well. So let's get into it. The aims and objectives for this evening are to list the key shapes and the indications of ultrasonic tips. So looking at why you would pick up the tip that you'd pick up and why shape influences that. Also, we're going to be describing Piezo technology, how that guides your tip technique, so how you use that tip, and think about or consider how different ultrasonic tips can be used at different stages of our patient care. Again, just really important that we understand why we're using what we're using on our patients, what is the indication, and what's going to give us the best patient outcomes, because ultimately making sure that our patients have the best possible outcome is what we're all about. So why do we use ultrasonic? Let's go back to basics. Let's just start from the very beginning. Why ultrasonics? Well, ultrasonics have actually been used in dentistry since the 1950s, which I know everyone thinks that's 50 years ago, but it's not. 74, almost 75 years of use. And at the start, they were actually designed for cutting teeth. And you can actually still now use certain ultrasonic tips for cutting teeth. Won't go into it here, but yeah, there are still some ultrasonics that are amazing for cutting enamel. But very quickly, dentists noticed that they were great as an ultrasonic scaler, used to remove deposits from hard tissues of the tooth, so enabling them to remove calculus, biofilm, plaque, and that's allowed the soft tissues around the tooth to return to health. The mechanical ultrasonic vibration breaks up calculus, biofilm, and stain in an easy and effective way. So what are we talking about when we talk about biofilm? Obviously, these huge communities of disease-causing bacteria, so multiple types of bacteria, all interlocking together, all working together, causing diseases in the oral cavity. They build up on oral surfaces, including teeth, gums, restorations, prosthesis. We see that sticky plaque everywhere. And it's 70% live. So 70% live organisms in comparison to calculus, which has got far less viable species. So lovely picture in the background there for you. Obviously, calculus is slightly different. It's calcified dental plaque. So actually, under tests, we know that it's mainly calcium phosphate salt, and it's built up on oral surfaces, including teeth, gums, restorations, prosthesis, and it is covered in and it includes viable organisms. So although we know that calculus isn't the 70% live, that plaque is, we know that it's because it's calcified, it's dead. It does actually allow live organisms, live bacteria to be sheltered by it, to live within it. And so we are aware that calculus can serve as a reservoir for bacteria. I explain it to my patients in a slightly different way, especially my little patients, that calculus is kind of like the houses that the bacteria has built. So they sort of live within those communities, those towns, those houses of the calculus. And I know that you were all looking for that, looking to see that picture better. So I thought, let me just let you see it in its full glory there. Calculus removal before and after on these. There's a lovely crossbite there as well. Lovely little crossbite example. So why do we use an ultrasonic? Well, there's multiple reasons why we love ultrasonic. Obviously, that vibration breaks up the calculus, but then we also have cavitation, and cavitation is what occurs at the free end of the tip. And so the more power that we put into the tip, the more cavitation we get. And that is essentially where the ultrasonic wave goes down the tooth, and I'm going to explain this in a little bit more detail. The ultrasonic wave goes down the teeth, and cavitation, or the imploding of these oxygen bubbles, starts at the antinodes with very little or no cavitation at the node. Don't worry, we'll show you a picture of this in a bit. So this is a high-speed image combined with scanning laser vibrometry to show individual microbubbles imploding and those bubble clouds lifting, moving away from the ultrasonic scalar tip. So what they're doing is breaking up that biofilm as well, imploding those little microbubbles. And then in addition to that, you have water, which provides lavage, it provides heat reduction, and aids our acoustic streaming, which can also disrupt biofilm. So it's got multi-function as to why we use ultrasonic, not just because it's a little bit easier than hand scaling. We talked about nodes and antinodes, and I drew this very artistic picture. I'm sure you'll agree, just to explain what that means, because if you think of your ultrasonic wave, it looks like this sort of sound wave that we've got. And our node is when it's at its highest of its vibration, and your antinode is when it's at neutral. And you'll see that you get more cavitation, you get those imploding bubbles when your ultrasonic tip's at its highest. And it's really important to understand that, because that's how we guide our technique. So if you're able to understand where that cavitation happens, then you'll be able to think much more clearly about your technique when you're using these ultrasonics, and making sure that you are using them to your best advantage. So, okay, that's ultrasonic technology, but what is available out there on the market today? Well, you can pretty much split your ultrasonics into your piezoelectric or your Cavitron style ultrasonics. So I personally use Piezo. NSK produces a Piezo handpiece. This is the one that I use, which is the Varios Combi Pro. But essentially the difference between Piezo or Cavitron, which is your magnetostrictive, big words today, is that you've got slightly different optimal frequencies for those handpieces. Piezoelectric scalar strokes also, they occur in a linear pattern, so it's a backwards and forwards motion. It requires slightly less water to control its heat. And also handpieces tend to be more ergonomic, so slightly wider, slightly easier to hold. And because the whole handpiece doesn't vibrate, you may find that you get slightly better tactile sensitivity as well. With magnetostrictive power scalars, basically what you find is the vibrations create an elliptical pattern. So, not quite the backwards and forwards that you're expecting with your piezo, but that does mean that all sides are active. So you can use it any side of the scalar tip and on a Cavitron, and all sides will be active. You tend to find that they are these metal stacks that are inserted into small plastic tubing, and they are slightly smaller, slightly more difficult to hold, and they can be a bit temperamental when it comes to, as I'm sure some of you will be aware, to sterilizing them and the stacks bending. That was always the problem at university when we trained on Cavitron. They were always broken. So here is my Piezo, NSK's Varios Combi Lux handpiece. And what we know about this is that with piezoelectric use, where the lateral sides are the only sides that are active, you have to think about your adaptation to teeth to make sure that you're getting that tip working to its best ability. Obviously, you can get multiple different types of tips, and that's what we're here to talk about today. And you will find that Piezo will, especially the NSK Piezo, will have three main settings: general, perio, and also endo, because I'm sure you're aware that a lot of endodontists will use ultrasonics as well when they're doing endo. So we do need to make sure that we understand these different shapes, and we understand what those different indications are and what the different settings are all about. Another little diagram for you of that, those waves, those ultrasonic waves going through the tooth. And this is just to hammer home that idea that only the lateral sides are active. So if you think when you're placing your scalar onto the tooth, when you're placing your piezo tip onto teeth, if your tip is vibrating up and down, and I know I'm using my hand and I'm probably really small on your screen. If you think your tip is vibrating up and down and the lateral sides are active, then on our first picture there, where you've got the side-to-side arrows, that will be sweeping against the tooth and it won't be causing the high-pitched squeaking noise that we've come to associate with ultrasonicking. So if you adapt it correctly to a tooth with a piezoelectric handpiece, then you will not create that high-pitched squeaking or rattling noise. It's when you use the wrong part of the tip that you will start hearing or feeling a rattling or a squeak. So this is why having the correct shape, the correct size, the correct settings becomes really important, because your adaptation will be easier if your shapes of your tips are for the indication that you're using them for. So if you've ever done any ultrasonicking on quail's eggs, you'll know what that noise is and how easy it is to break them if you're using the wrong sides of the tips. So what tip when? Well, there are a number of different structures to consider in the oral environment. So they've all got different morphologies. If you think about the shape of an anterior tooth versus the shape of a posterior tooth, if you think about furcation involvement, if you think about concavities on root surfaces, then ideally you need to think about your tip shape designed for the situation and also as comfortable for you as a clinician as it possibly can be. So really important not to just consider, the patient, but also yourself. What's going to be the most comfortable thing for you as well, working ergonomically. So the first thing to think about is, are we using our tips for general use, for perio use, or are they restorative, like I was saying earlier, the ones that cut teeth or endo tips? Obviously, we're not going to be looking at restorative endo tips today. We'll be focusing on general and perio tips. And you know if they're a general or a perio tip through NSK, because they will be named G for general, P for perio. And then within those two bandings of tips, you will have a number of different shape considerations. And when we're talking about shapes of tips, it's not just the shape as though you would think of a scaler on a hand scaler. We're also thinking very much about the cross-section of the tips. If you think you're using the lateral edges, then the cross-section will be really an important thing for you to think about. Rounded tips you might find are better for biofilm disruption, for getting into small concavities, or for interfurcations. Rounded tips tend to also be for softer calculus, not for removing hard deposits. So you tend to find a lot of P tips are rounded. And then with the semicircular pattern tips, these are much more robust. If you're looking at a semicircular tip, you'll probably be looking at one that's more for heavy calculus removal, for your stage 1 first time you've seen a patient. And those semicircular tips, you can see from the picture that we've got there, the cross section is rounded on one side and then two essentially cutting edges. And then one of my favorite ones is a rectangular, and although we call it rectangular, it's actually got these rounded edges. So they are absolutely fantastic for patients who do have calculus, do have work to be done, do have staining, but it's not heavy. So yeah, I really love the rectangular cross-section tips. And then a couple of more specialized tips or shapes. You will have a diamond tip. So there's quite a lot of perio tips that have diamonds on the edges. Now, these are very similar to those restorative tips I was mentioning earlier that cut teeth, but the diamonds are of a smaller grade. And think of it like sandpaper. It's a really fine sandpaper on the very edge of these rounded, very fine tips. And then you also can get a rhombus shape. And these tend to be your extremely heavy duty for removing very heavy, tenacious, and often that subgingival sort of spurs that you see when you first see a patient who's not been in for 10 years. So that's sort of our cross sections. Now, I like to divide things even further into our stages of treatment. for our patients, because yes, we have these whole host of tips, but I don't know about yourselves. When I was first presented with a catalogue and said, yeah, choose some ultrasonics, whatever you want, I was completely confused and I just didn't know what I was being faced with. So I like to really think about, okay, what stage is my patient at? And so therefore, what tips am I going to choose for the tray? And make sure that I have a variety of tips for each indication for each patient. So we'll be looking at these particular ones on the screen today, but there are a ton more. And I hope that by looking at their power settings, by looking at whether they're general or perio, and by looking at their cross sections, you can start to formulate for yourself a bit of an idea about what you would like to use as well. So obviously the first stage is stage 1. And stage 1 patients, oh my goodness, this chap is such a lovely guy. And his new girlfriend sent him to see me saying, you need to go and see a hygienist. And this is what I'm talking about, stage 1. Now, obviously, not every patient at stage 1 of their perio journey comes with quite so much calculus and quite so much work to be done, but I thought, we're all in it for the fun, aren't we? We all love the calculus removal, so I thought you'd enjoy seeing this picture. And yes, stage 1 is the first time your patient comes in. Think about, it's often the receptionist's boyfriend or someone with heavy calculus. They're going to be needing quite a lot of treatment, and you just need to get that calculus off to allow them to be able to perform effective home care, effective oral hygiene. So this is the type of tips we'll be thinking about for stage 1. G5, G6, and G8 are my go-tos. Now, you might notice the cross sections on these 3 tips are all the exact same, and there is a very, very good reason for that. So I like to have these really robust cross sections. I like the rounded edge because they cause less trauma, but you've still got 2 kind of cutting edges that remind you very much of a hand scaler. So let's have a bit of a closer look. This is a G8. We won't go through all of them, but this is a G8, and it's a very thick, heavy-duty tip. You can see it's sort of short and stubby, and it's got this very wide, broad shank to it, essentially. And that's fantastic because it really will sweep over the enamel surface, over the root surface, and you get a huge surface area that you can clean with this tip. Now, obviously, with it being a rounded cross section at the back and then these 2 straight flat edges, it also becomes much more obvious for you as a clinician how to adapt this tip to the tooth. So it's a nice, easy one to use. It's quite intense, and you can use these ones on pretty high power settings. Now, not every chair is made so that you can adapt from G to P and change your power settings. So your chair may be different, or you might be, like myself, working on a standalone machine like the Various Combi Pro, where you can switch between the settings. But essentially, with the G setting tips, and with these thick, heavy-duty tips, these are the ones you can have on slightly higher power settings. I will, don't worry, be giving you a QR code so that you can look up all the power settings later on at the end of this presentation, so that you'll know exactly what settings you can use for what tips you have. So these are great, really heavy, thick, tenacious calculus. It's got those 2 working edges, and because it's got that rounded back to it, it reduces gingival trauma as well. Now, I filmed a load of videos of me using these tips, and then for some reason I got to this G8 and I had already removed all the calculus. But at least so you can see the adaptation of this tip, I wanted to show you this video so you can see that we're going to the side, and what I'm doing is doing these lateral strokes along the tooth surface, and you can see that I'm not using the very point, I'm just using the edges, and usually the last 1 to 2 millimeters of the tip is your most active, because you remember that sound wave that was going over, or that ultrasonic wave that's going over. We know those last 1 to 2 millimeters are your most active place. your place where you've got your cavitation, where you're going to get the most lavage as well for your patient's best possible outcome. Now, also in my arsenal for these first stage patients, these stage 1 patients, is a G5. I will grab a G5 if it's a standard normal patient, you know, the ones that come and they are 5 to 5 calculus, and there's nothing anywhere else, but just 5 to 5 calculus and maybe distal of an upper 6, right? And a G5 is fantastic for that. It's actually quite a bit smaller than the G8. It's a bit narrower, and it's also a little bit shorter, so it's quite nimble. I really love this tip for you know, when you've got those patients that have booked in for half an hour, they've got a bit of a wall of calculus, but it's not crazy. I really love that for this. Because it's a bit shorter, it's not the ideal tip for getting really deep into proximal. So if you have noticed any calculus on radiographs, on the root surfaces of teeth, you know, there's little spurs, you may find that you struggle to reach it with a G5. But this is fantastic for, like I say, those anterior 4 to 4, 5 to 5 style patients who just need a bit of excellent calculus removal. This is also really amazing at stain removal. And I think because it's just that little bit smaller, it can get into all those nooks and crannies just that little bit better. So if you find that the G8 style tips are too wide, too bulky, especially if you've got patients who have got misaligned teeth, crowded anteriors, I really would struggle with a G8. The G5 is a really great place to go. So I love this tip, highly recommend. And more calculus on this one. Here is our adaptation. So you can see, again, just using the very lateral edge of that scaler, and it's so incredibly effective. And it will just melt away your calculus. You can hook underneath as well. You know, when you get those little bits that sit over the gingiva, you can hook it off. And yeah, it's a wonderful, really nice thing to be able to use for our patients. And then absolutely adore this tip. Now you may buy it as a G6 or you may buy it as a G16. They are essentially the same thing. G6 is just ever so slightly shorter than a G16. But this is probably my favorite scaler, if you can have a favorite. It's much longer and finer. So I work in the financial districts of London. I have a lot of patients who are very well maintained. You know, they tend to have a bit of interproximal calculus, but they come really regularly, insurance-based patients. You know the ones, or you may not, but may wish you did, because it does make life a bit easier. But this tip is great for them because you really can get right into proximally with it. It's great for all around excellent care. It still has those two working edges and it still has that rounded back. And the thing about having that rounded back is it reduces your chances of gingival trauma so much less in terms of concern about bleeding and things like that. And here it is working. So you can see how much longer it is. It's much longer. So if you are finding that you struggle with the linguals of 8s or round the back of an 8 when you're doing your general stage 1 patients or your maintenance patients, you know, that they haven't had loads of work done or they don't need loads of work done, but you've got long reach places you need to get to, then this is going to be a fantastic tip for you to try. I love that long fine tip, and I just feel it's slightly more refined. So it's nicer in a way to be able to use that for patients who don't have heavy calculus. So that's our stage 1. Now thinking about stage 2 patients. So stage 2 patients, we're talking perio treatment now. So they've had all that calculus removed, they've done their home care, they've reduced their bleeding scores, they've reduced their plaque scores, and they generally will come back, you know, covered in cortical stain instead, because they've really taken your advice. So this is the kind of patient we're talking about. They've got pocketing, they've got subgingival calculus, but they've done their home care, they've been doing their homework. So my first port of call, we talked about the G6 already. The G16 is very similar, okay? It's just ever so slightly longer, but G16 is my go-to first port of call for perio treatment. So it is actually not considered a perio tip. It's a general tip, but it's very good for those first stages of removing that interproximal subgingival calculus. Because it's such a long tip, it can get right into deep pockets as well. Really great for posteriors, getting subgingivally and interproximally. So think of this as a first thing that you're going to do just to try and clear as much of your calculus as possible. Now, I personally will use this G16 and then Gracie hand scalers. Call me old-fashioned. I love a Gracie hand scaler as well. I love that tactile sensation, but there are times where I'm having to flip between ultrasonic and hand scaler because you need to break up or loosen up a really tough spot, and this is where the G16 comes in really handy for that. So we'll show you on the video here. You can see it's a really long tip, really thin, super nimble. You can use it on actually really high, quite high power settings, not the highest. So if you're thinking you're on general and you're between a 0 and a 10 on general, probably the highest I would have this is a 7. So yeah, it's a really lovely tip for you to be able to get right to the posterior teeth, but also, well, video is not great there, is it? Sorry, I just got a load of gum. But also very effective, even if you just had this for your maintenance as well. So I really, really love this one. If anything, that's the one I would be wanting to incorporate into my working life if you don't have it already. And then once you've done your larger deposits, your larger subgingival deposits on your stage 2 patients, and you've maybe gone around with your Gracies, you may find that you have those really tricky spiculae deposits, those really hard black spicules that are very difficult to reach. You're struggling to get them off root surfaces. Maybe you're struggling to get into furcations as well. This P1D is one of those just lifesaver tips. I don't use this on every patient. It's not a matter of course kind of tip for me, but it is really helpful for patients that have tricky areas, so especially furcations. I really love that. Now, this is a circular cross-section tip. So we've now moved into the realms of perio tips. It's a circular cross-section, but you can just see on the very end of that sort of curette-shaped tip, it looks matte. It's got a matte effect, and that's because D stands for diamond, and it has got this diamond encrusting. Now, like I said at the beginning, think of it a little bit like a very fine sandpaper, very, very fine sandpaper. And what that's doing is giving you the opportunity to just work at those really tenacious spicules in those really difficult areas. So because of it being a circular cross-section, you can get right up in under furcations as well, and into those sort of concavity areas of root surfaces. So where the root has an odd morphology or a difficult shape, I often recommend these lovely long fine diamond tips for that. So yeah, really, really helpful to have this in your kit for those particular moments where you think, I'm just going over and over and over and potentially burnishing some calculus. This will stop that from happening. Or if you're trying to treat areas that have been burnished in the past and you've been unable to get any purchase on those flattened, burnished areas, then you will find this P1D tip is wonderful. Now, what's even more wonderful about a P1D tip is that those diamonds, as with any tip, they will get worn and wear away. And over time, you might find that there are no, diamonds on all surfaces of your P1D. But at that point, that scaler can still be used. It will still be effective at biofilm removal, and it basically turns into a P1 tip. So you get 2 for 1 with this tip, because as soon as you've used up all the efficacy of the diamonds, you actually still have biofilm disruption with what is essentially now a P1 tip. So really nice. You can see me getting into a little concavity there on the mesial of that 6, just being able to get to those slightly rougher root surfaces and adapting that tip around that curvature of the root as well in a really comfortable way. Into that furcation, just making sure we're getting that curve of the furcation or that crutch of the furcation with the inside edge of this ultrasonic tip as well. So really helpful to be able to use that mesially and distally within a furcation as well. And now we're going to get into some pretty funky specialist looking tips. And again, this is perhaps not to be used on every single patient, but it's the really difficult ones. And these are the ones where, you know, if you don't get into these furcations, it's going to be a referral for specialist care, because it's an angulation difficulty that you're having. And you may find that you're able to prevent that need for further non-surgical periodontal treatment if you're able to get into these trickier areas slightly more effectively. So for your stage 2 patients who have got furcations, especially mesial and distal on sort of upper molars, then the P2D and the P3D are left and right-handed twisted tips, and you can see they look like they've been dropped. Essentially, it looks slightly bent and twisted and weird, and they do look really confusing when you first put them onto your ultrasonic, because it's a real struggle to be able to work out where they go or how they work. However, what I find is once you get them into the patient's mouth, it suddenly clicks and makes sense exactly why you would use these tips and how you would use these tips, because they're actually very, very well ergonomically designed. So you'll be able to see here that it is fitting so beautifully down that mesial root, and then the shank of that tip curves out towards the mouth. So you'll find that the right-handed tip will be able to be used on the lower left and the upper right, and the left-handed tip obviously on the lower right and the upper left. And as soon as you pop them into the mouth, you can really see. Now, I've done this one with it switched off so that the water doesn't stop you being able to see how you can really then access the very tricky areas. You see it hooks over the crown of that tooth to give you much more purchase in the furcation, and it also will work mesially and distally. So slide it in there, work on the lateral sides of it, of the tip still. Again, it's for removing very, very tenacious little bits of calculus. And then you will again use that lateral side as though the root is a tooth. So the mesial of a root and then the distal of a root, the mesial of the root and then the distal of the root. But you can hook into that sort of crotch area of the furcation as well. Love these left and right-handed tips. And so I've written those diamond tips as a circle with these little triangles sticking out so that you can remember that they're diamond, and they can be a little aggressive if you're using them. You shouldn't use them on all cases all over every tooth. It really is just for where you've got those really strong, difficult, tenacious bits of calculus. And then maintenance. Okay, so we've done our stage 1 heavy calculus, crazy, build up kind of patient. We've done our stage 2 non-surgical PMPR patients, and now we're thinking about maintenance. So our patients that are our maintenance patients are the ones that come back with very little calculus, very little pocketing or bleeding or plaque scores, and that we're there to just support them in continuing to be stable. So the maintenance patients, you're thinking stability, but also when it comes to maintenance patients, it may be that they need something else maintained. So maybe, in this case, this patient came needing their composites maintained. And Maintenance is very much about being aware of what's going on in the patient's mouth and choosing the right equipment for that patient at that time. If you've not done my composite maintenance webinar, please do, because we go into a lot more detail about looking after the composite patients as well. Now, I like to stick to a P tip again for my maintenance patients. Now, P20 is the one tip. You remember I said I got super overwhelmed when I was given a load of choice before I understood really about ultrasonics. I was super overwhelmed and I thought, well, that's the longest one. And so I can't believe I'm omitting this. I thought, well, it's really long, which means it won't get blunt as quickly because there's more of it. How wrong I was. So the P20 tip was my favorite. It was the one that I used to use for all of my patients. And you know, that meant that on some patients it was really difficult, and on some patients it worked really well because they tolerated it so well because it's such a gentle tip. Now, where I went wrong in my thinking was I hadn't understood that P tips are for biofilm removal. And you can understand that now if you look at the cross section of this tip, it doesn't really have a working edge. It doesn't have a cutting area. So it does work for removing soft calculus. It works amazingly well on biofilm. It is absolutely fantastic because it's long and thin and it can really get into difficult pockets, difficult areas of teeth. And it's actually really lovely to be able to adapt this scaler, this ultrasonic tip, to patients' teeth without getting that rattling. So I find that those rounded tips are easier to adapt without getting that squeaking, rattling, or sensitive feeling. And that's why I love the tips, because I felt that the majority of my patients tolerated it so well and they thought I was so gentle. And then I was coming across, you know, situations where there was loads of calculus and this wasn't working at all. And the problem we have is if you do end up having only one type and only one type of tip, you either go for a really aggressive general tip, and that can be really sensitive for patients who don't need that aggressive tip, or you go for a P tip and you end up turning up the power on these too high, and they can break if you turn it up far too high. So as I said before, we'll go into, or I'll give you a QR code for all the different power settings. But yeah, these ones are wonderful for patients who've just got soft calculus, biofilm, and maybe the odd little furcation that needs maintaining. Little video for you to see of that P20 being used. And what I really love to do with a P20 is to sweep it around the sulcus. So it's really nice because it is so gentle and it is very unlikely to cause any gingival trauma at all because it's round cross section. You can really sweep it through that sulcus and you tend to find you see lots of biofilm coming up. And it's really nice for just flushing out those pockets that are perhaps, you know, non-responding pockets, or you know, your 4mm pockets that have had perio treatment, aren't bleeding, but that just really need flushing out on a regular basis. So really, really love P20. But as I say, be aware that P20 is not for heavy calculus removal. And then again, a left and right-handed tip. This is just like the P20, but it's the P25 right and left. And so it looks like the P20, but it looks like it's been dropped and bent and trodden on. And that's why it's got a curve on it. But it's got this wonderful curve to get into tricky areas. I've got maybe a handful of patients in mind who I would not allow my clinic to book on the same day or back to back because they need these tips, and I have them as special tips for patients whose teeth I'm holding on to dearly. And we've been maintaining these, like, you know, those furcations where you can pretty much see all three roots and you can see through between them. This is where my maintenance P25 right and left come in, because they have that wonderful bend, that wonderful curve, so that we can maintain them. So a lovely little video here of a lower 6 and how we can get into really tricky areas. You can see how it adapts around the crown of the tooth really nicely. And again, it's a sort of almost twisting motion. So you get it into the pocket and then you can twist that in, around, and into your furcations for your patient. So yeah, you see that twist into the pocket and then twist to the distal. And you can see how that adapts onto the crown of the tooth as well. And what's really interesting, gosh, you can see that little bit of calculus down under there as well. Now I want to go and get that. What's really interesting is, again, you pop this into the patient's mouth and you suddenly know how to use it. It just comes naturally. But if you look at it outside of a patient's mouth, it's really tricky to know where it goes and what it does. So it's a little bit of a magic trick for you to show your nurse. But like I say, I really do have just a handful of patients who I think that, you know, those are special tips for them, and it's really helped us. It's helped us look after those patients' teeth that otherwise would have been hopeless prognosis, because we've been able to get into those difficult areas, and I really feel that that's made a massive difference. All right, well, those are my favorites. Those are the ones that I have on my trays in my arsenal. But regardless of which tip you choose, we also need to be aware of our care and maintenance. And I wanted to put this slide in here because I feel like we just need to say these things once, and then everything, you know, that a lot of people struggle with making sure our practices allow us enough equipment to be able to follow the best practice. So care and maintenance is this, think of it as the same way as perio. We've got stage 1, stage 2, and maintenance. So stage 1 is they need to be cleaned with alcohol-free wipes. A lot of the plastic casing on your piezoelectric handpieces can break or degrade over time if we use the incorrect products to clean them. So it must be wiped with an alcohol-free wipe. You can clean the handles and the leads. Then you sterilize them, and you sterilize them in a cassette. I think I have a video of the cassette coming up. And each handpiece, cannot say it enough, is a per patient use. So exactly the same as a fast handpiece, a slow handpiece, it gets sterilized after every patient. And then obviously tips, we've talked about it a lot, tips wear, and they have to be replaced when they're worn. Now you can reduce how much they wear by making sure you know the power settings that are appropriate for the tips you're using. So use the right power settings and obviously replace them when they are worn, and you'll be able to tell when they're worn because of the tip wear guide, which I've got a video of coming up soon. So these little blue keys that we get to put our tips on and off with, these are actually called a torque wrench. And what's amazing about the torque wrench is that it clicks when the tip is at the exact right torque, the exact right tightness for the tip. So don't click it past the first click of the torque wrench. And then also these handpieces can break if you twist them to undo. See where the 2 dots are? You just have to pull apart at that point. If you twist it, then you might find that the leads start to break on the inside. So just train your nurses that when you dismantle this, they have to be pulled, not twisted. The amount of them that have broken. And this is the autoclavable cassette. Now we know it's autoclavable. We can tell they're autoclavable because they have a little sign on them saying, you can see that sign 135 degrees in the top right hand of this video. All of your tips for your patient, so you know that you might have chosen 3 for your maintenance patients, or you might have chosen 3 for your stage 1 patients. All of them will fit into that cassette along with the handpiece, so you can have 1 per tray, and that whole thing goes into the autoclave together on just a normal cycle. So that just keeps everything together. And these are the tip wear and replacement cards, which will tell you if your tips need replacing. So if they're in the green zone, they're at their most effective. If they're in the yellow zone, they've actually lost 25% of their efficacy. So they won't work as well as they used to work if they're in the yellow zone. And if they're in the red zone, they need replacing because you've lost 50% of your efficacy on those tips as well. So just if you need a tip wear guide and you've got an SK, then you can actually contact your rep. You can let me know, and I can put you in touch with your rep, and and you'll be able to get a tipware guide so that you can show your practice, I need a new set of handpieces or tips or whatever it is. You can get the power guide and a tip guide, so all of the tips on this QR code. So annoying if you're watching this on your mobile phone because you can't scan it, but if you're not, if you're on a laptop, then you can actually scan this QR code now and you can get a PDF of all the tips, all the power settings you should have, and you might find some things in there that I haven't mentioned today that you love the look of and want to try. So yeah, really worth having a little look through. And if there is anything that you're interested in and you're not sure if it's going to be if you've got the indication right, or you're getting the right thing, pop me a message. I love all of the tips in there, and I've tried most of them. Feel free to just pop me a message and see if there's anything else. I think we've got a couple of questions already, but if anyone does have any questions while we're chatting, pop them into the Q&A and let's cover a few.
Fabulous. Thank you very much indeed, Kat. That was really, really good. It's so interesting to see different clinicians picking different tips up. So those tips wouldn't be the tips that I would go for first, but I love the fact that maybe, just sort of thinking outside the box and looking at those things, definitely.
Yeah, it's interesting, isn't it? I suppose it's just down to your experience, what works in your hands, the type of cohort of patients you have, because I know I'm so fortunate. I've
Yeah.
super well maintained patients majority of the time, and and I also have fantastic equipment and nurses that it's all very, very well maintained, and I am very fortunate. I have a very easy life. So yeah, it might be that other clinicians out there actually want much more chunkier scalers as well, because they need it for the cohort of patients that they've got. What sort of things are you thinking then, Catherine? Do you go more fine, or do you pick?
No, yeah, I mean, I probably would go the P20 I would use, and then probably P21 left and right, and P26 left and right I quite often use. But I do like the idea of the diamond. I'd probably be a little bit like I'm being a little bit traumatic, but
Yeah, it's one of those things, isn't it? I think, like I say, it's not for every case, but there are going to be cases where I just feel that you cannot get a Gracie in because of the shape. For instance, the top of a fixation, you can't get a Gracie in, but you need some sort of purchase without putting a sharp edge. And so that's where I found them to be just incredibly effective and really quick. And yeah, I wouldn't go for hours with one.
No.
It's basic.
Yeah.
But yeah, it's just been really, really helpful for us. So
yeah, I'm definitely going to try it. Definitely. I've just got to wangle some tips from my boss now. Yeah, well, new tips from my boss.
I have seen 3 questions about
yeah. Yeah. So that was going to be I was going to lump those all together and go with the question about pacemakers.
It is one of those questions that comes up all the time. Listen, there have been very old studies around pacemakers and ultrasonic waves affecting pacemakers. Now, the majority of pacemakers these days are shielded and there are no problems. There's no concern. But because we can't always say that that's a guaranteed on every single patient, I would say always contact the cardiologist and ask their opinion. I think it's getting rarer and rarer that it would be an issue, but we're clinicians first and foremost. We should put our patients first and foremost. There are no clinical differences to outcomes between hand scaling and ultrasonic scaling ultimately, and so contact the cardiologist, see what they have to say, and then and then make your decision in the best interest of your patient.
So I've just seen one maybe that might have it probably doesn't have a slightly different answer, but just somebody saying that they have just moved to a practice with a Cavitron. So obviously that's magnetostrictive rather than a piezo. So is there anything different that you would say there?
So yeah, I'm not able to sort of suggest any tips or anything with Cavitron because I haven't done any sort of official training with Cavitron. But they do have essentially loads of different shape tips, thin cert, they've got bendy tips as well. And with Cavitron, you'll find that they also have the different cross sections. So have a look at the shape and have a look at the power settings indicated for the tips that you are buying and relate that to the shape of the patient's teeth that you're using them on, the amount of tenacity of calculus as well. And it should all follow through similar sort of concepts. The only difference being with Cavitron, obviously, you need to use a lot more water, you need to make sure the stack is filled, and also be aware that you can use all surfaces of your Cavitron rather than that lateral cleaning that you do with the Piezo that I've been speaking about this evening.
So in terms of pacemakers.
Oh, yeah.
That's fine.
I think it's exactly the same answer. You know, it has to be. You have to go to the cardiologist and ask them. And I believe, you know, there has been studies to show that there's a difference between Cavitron and Piezo. However, again, until you get that sign off from the patient's physician, we're not in a place to decide.
Brilliant. Okay, so Jackie's asked, with the P1D, how long roughly is the lifespan before the diamond coating is no longer effective? Because she needs to sell it to a practice manager. We all know this.
Yes. Actually, honestly, they do last a very long time. And I sort of kid a little bit about it being a two for one, because as we were just discussing, I wouldn't use it all the time for every patient. And so it's very specialist. And as long as it doesn't get bent in the autoclave or dropped or anything like that, you'll probably find that it's still effective and still has that diamond coating on it for, you know, probably 6 to 12 months. If you're doing perio treatment, you know, if you're doing non-surgical perio treatment 6 times a week and you might use it on one patient out of those 6, maybe 2, then yeah, you probably got about 12 months of really, really strong effective use, probably more. I can't remember the last time we bought a P1D. I think I haven't bought one for a good 18 months. They don't wear out like instantly. You don't see the diamonds coming off or anything like that. But the fact is, once it has worn off, it's still effective anyway. So it's still a great tip to have.
Brilliant, great. So the P20 used for maintenance, is it used on the perio setting?
Yeah, absolutely. So anything that's a P, keep it on the perio settings. And this is the problem. If your chair doesn't have P, E, and G settings, then you kind of have to divide your 0 to 10 settings up into 2, for P being the 0 to 5 and G being the sort of like 4 to 10. They do overlap a little bit. So yeah, if it's a P tip, keep it on the P settings. And as I say, on that QR code I gave you earlier, it will tell you exactly how high it can go. And then if you don't have P settings on your chair, I wouldn't have it higher than a 5.
Brilliant, great. I've not scrolled right down, but I've just seen two, which I'm just, if it's all right, going to lump together a little. So Barbara said that she likes the P25 for use under all on fours, lingual, where it's hard to get. What tip would you advise for implants? And then somebody else has asked, what about implants?
Oh, I'm going to revert that question to you, Catherine, because
Oh,
I I am not the implant person to ask. So what would you use?
You treat implants.
But we don't actually have very many huge implant cases, and I tend to find, again, really well maintained patients, and I tend to embellish majority of them. So
Yeah.
what would you use?
Okay, so long answer or short answer? The short answer.
All the knowledge.
Okay, so a few caveats. I wouldn't use a stainless steel tip on whether it's an all-on-4 or whether it's a single implant on a healthy implant. If you have disease on a mucositis case, again, no matter what prosthesis is on the top of it, I may use a peak tip if you can get it in and under and onto the implant collar without causing trauma. If you have implantitis and at that point you're in a sort of point of no return, then I would pick, in terms of the NSK tips, the P21 left and right, and then there's also do a P11 left and right. I wouldn't be using a straight tip because you've got to get into the threads. You wouldn't be able to adapt a straight piezo more than maybe 3 or 4 millimeters submucosally. So I would definitely be using left and right. I would go to right to the bottom, coming from mesial to distal inside the thread and work upwards, and then change your tip, go back down. So opposite tip, go back down, mesial to distal. So you're sort of in a sense cross hatching. In terms of stainless steel tips on prostheses, you are likely to scratch, and I would definitely use a peak tip. The peak tips are brilliant on prostheses and dentures and stuff like that.
Oh, wow, now we're feeling major imposter syndrome. There is a reason why you just won best hygienist.
Oh gosh.
I'm right in there.
Anyway, let's move on.
Aren't we all just in awe? Amazing, interesting, helpful advice as well. So I hope you all loved that.
Bless you.
Little bit
Thank
of
you
an
very
extra
much.
added value for you there.
Okay, so Lisa, she's really struggling with tenacious sub. Any tips?
Oh, it's all about adaptation. And the thing is, if you are struggling with tenacious sub, it's that thing that I was talking about before about go with your ultrasonic, then go with your Gracie or whatever you're comfortable with, hand scaler, and then come back to your ultrasonic. Don't expect yourself to be able to just do the whole thing in one go. Yes, obviously we love it when it comes off in one big chunk, and that's wonderful. But it's about adaptation, and it's about getting yourself into a better working position as well, moving your patient as well. I think a lot of people tend to struggle with, like the mesial, distal, and lingual of, if you're right-handed, lower right 4s and 5s. I think that's a really tricky area to get to, whether you're using ultrasonic or hand scaler. And I find that if you move your patient onto their ear on the side that you're struggling with, move yourself around to sort of like 8 o'clock position, you'll find that you've got the purchase that you need. And I think a lot of us are sometimes a bit anxious about moving ourselves or our patients because we wonder what they might think of us when we're doing that. So just be bold. You're doing your best for the patients. And I think, yeah, move people around until you feel a bit more comfortable. But definitely with super tenacious sub, look at your scalar tip. Go for sort of a G tip, G16, G6. long and thin, so that you can really get into proximally, and make sure it does have a bit of a cutting edge. So you don't want a round cross section, you want to have a semicircular cross section.
Brilliant, great. So a couple of just statements really. Barbara's a big fan of the G16 too, and she said thank you for a great webinar. And then Jackie said she loves her NSK VCP, and it has revolutionized her perio treatment, which is great to hear. And she went on Deepak's masterclass and would recommend it to all clinicians. I've not been, so I can't say. You've been on it, haven't you?
Oh, I'm a groupie. I've been 3 times. Yeah, highly recommend. And also, you know, you get a full day's hands-on with Deepak when it comes to ultrasonicking and hand scaling. So I think that's wonderful. And really anywhere that you can have a bit of hands-on. I mean, we're doing quite a lot, aren't we? We're in at OHC this week. So anyone who's at OHC, if you haven't managed to get a space with us on the NSK stand, come over anyway. Just come chat, come and have a look. We won't be busy the whole time. Just get something in your hands and ask your questions and have a really good look, because we will be bringing so many different tips, won't we?
Yeah, because we're doing a combination, aren't we? So you're doing some composite, some sectional matrix stuff, and I'm doing implants, and then Lauren, Nina, Amanda, we're doing tips and air polishing.
And maintenance, air polishing. So we've got it all covered. So I think come anyway, even if you're just watching what's happening, there will be plenty of us hanging around the stand anyway, so you can chat to all of us. And I would love to say hi to as many people as possible.
Yeah, it's really nice, isn't it, to see people that you've watched on a webinar. So if I prepared a few tips for treatment, but don't use them all, would they still wear if I ultrasonic and autoclave them? Just wondering if it's best to prep beforehand or on the go, working with no nurse and trying to work smart. That's hard.
It's so tricky. It's so tricky. I like to just have those cassettes with my tips in them ready, and they do just go through the autoclave whether I've used them or not. They don't tend to wear unless you're using them. But if you didn't have them in the cassette and you don't have them in the torque wrench, then obviously metal against metal means it will wear in the ultrasonic bath. So just I personally, you don't need to put them in the ultrasonic bath. You just need to give them a scrub over, rinse, and then with your handpiece, because you wouldn't submerge your handpiece in the ultrasonic bath either, get that into your cassette and put that on the cycle. So me personally, I do ultrasonic I do sterilize ultrasonic tips even if I haven't used them, because I keep them in sets like I do with my hand scalers.
Okay, so is there a perio masterclass I can attend? A Piezo masterclass even, sorry. I'm a new grad and I'm using Piezo as a opted from Cavitron at uni, and getting a lot of screeching in certain areas. We've all been there. But I'm now thinking it may be due to the tips I have, very few long and usually posteriors that they're struggling with.
Well, there we go. I mean, yeah, I mean, I'm so, Natalie, if it was only for you, then I'm so happy that we have been through this, because I have been there, and I'm sure you've been there as well, haven't you, Catherine?
Definitely.
You've gone from Cavitron maybe, or you have only ever had one type of tip and you just can't work out why, and you think it's you, and actually probably it's not you, that's having this problem. It's probably because the tip isn't the right tip for what you're trying to use it for. So there are plenty of people that do tips courses. We've mentioned Deepak already. Lauren and I actually run a full day composite maintenance, which is, although it's titled a composite maintenance course, it is actually about using all the powered instruments. So it's called Powered Precision, and you can find it on the NSK website. It's a full day where you will practice and be trained on ultrasonic piezo, fast handpiece, slow handpiece as well. So fast and slow for removing overhangs and for polishing composites, and then also the air polishing. So you get a full day of hands-on with us, and that's on the NSK website. It's called Powered Precision. We are, I believe, running one in March next year. But if you can't wait that long, like I say, just come to any of the NSK stands at any of the shows. We're always at Showcase. We're always at the Excel Centre. One of us will be there, and all of the reps are wonderful. If you're really struggling, you can just ask the reps to come to your practice as well. So yeah, don't suffer in silence, Natalie, as well. Just pop me a message anytime if you want to chat things over.
Brilliant. So just last few ones. Are NSK tips interchangeable? I use 10X and PFU tips. What tips are similar?
So although many manufacturers will tell you that you can use their tips on NSK handpieces, I would be really wary. The technology that goes into creating these handpieces and the tips to make sure that they work together properly is unbelievable. And one of the reasons why I love my Various Combi Pro is the handpiece gives you feedback. So it's actually reading the ultrasonic waves that are going down the tip. And it will change the power settings for you depending on how well the tip is performing, how hard you're having to push, all of these sort of things. If you start using tips that are not designed in that way or haven't had that same level of manufacturing, there are concerns as to what that might do to your handpiece. So be really wary about interchanging tips. I always would say if you're using an NSK handpiece, use NSK tips. If you're using EMS, use EMS tips. Same for BA International, try to stick to the right brand.
Sorry about that. My laptop's about to go on. Sticks to me while I plug it in. That's not good. So anything wrong with using a P setting with a G tip?
No, not at all. So you can absolutely go for lower settings. It's just I wouldn't go higher settings for the tips. And the point being that they are designed to be able to cover, that range of power. And if you go over that range, then that's going to be a little bit more of a problem. Yeah.
And I think this is our last one. Thoughts on the P40, P41 tips?
From memory, the P40 is a bit like a irrigator, and it has a black band on it. So it's a little bit like a WHO probe, isn't it?
Yeah, that's right, yeah.
And it's got a black band. And so it's not there to remove biofilm. It is an irrigator, and it will be fantastic for, after perio treatment, after you've done non-surgical, if you're just wanting to flush out pockets, but it's not there to remove biofilm or calculus. So just be aware that it's not really a scalar tip, it's an irrigator.
Brilliant. Okay. And then Jackie said, thank you very much. And a thank you for answering my question. I have attended previous webinars with Kat on this subject, but still learnt lots. Thank you.
That's so lovely.
That's lovely, isn't it? That's brilliant.
I'm always surprised that so many people, can't believe how many people have logged on this evening on a Thursday.
No.
Thank you everyone for being so incredibly engaging and asking all your wonderful questions. And as I say, please do reach out and contact us if you need any support. The last thing anyone wants is for anyone in the hygiene or therapy world to feel isolated and like they don't know what to do. So yeah, please reach out.
Yeah, definitely. Someone has raised their hand. Let me have a look.
Yeah, hi.
I think it was Lisa. I don't know. Does Lisa want to ask a question? I don't know whether it was intended or not. Whilst, if Lisa, if you want to type something in either the chat or the Q&A, if you do want to ask Kat a question, and I'll just recap We are recorded. If you just give us a little bit of time to get this onto my NSK, it will be about a week to 10 days before that's uploaded. You should get notification that it's there. In terms of CPD, you'll get an email early next week asking you for some feedback. I think you'll probably have to answer a couple of questions, and then you will get your CPD certificates. Any problems if you email, I think it's NSK, isn't it? nsk@gmail.com, and we can have a look there. Let me just look. There is somebody's written something now. Just two thank yous on there, Kat. So I think we're good.
Amazing. Well, thank you so much for hosting me this evening again, Catherine. It's always a pleasure, and so nice
Pleasure to host you.
And obviously, congratulations one more time for your
Oh,
amazing.
thank you very much indeed. And hopefully we'll see lots of people on the NSK stand next week.
So exciting.
Yeah, can't wait. It'll
See
be
you all
great.
then.
Bye. Bye,
Bye.
everybody.